So just make sure you take note of the date, and the other option would be you just become an EASL member, because you then will get emails about that all the time. Thank you very much.
Dear Professor Peck, dear EASL board members, ladies and gentlemen, it is always a pleasure to address you at the EASL annual conference, and I would like to thank you on behalf of the European Liver Patients Association for the opportunity. This is a very exciting and at the same time a very discouraging time for liver disease patients. It is very exciting because new treatment possibilities are opening up in various liver disease, particularly hepatitis C. What we could not imagine a couple of decades ago is a reality today. More than 80% of patients can be cured of hepatitis C thanks to a number of innovative treatment choices. However, it is discouraging because not much progress has been made towards the adoption of a comprehensive policy framework on chronic liver disease. Chronic liver disease is still diagnosed too late, and it makes little difference if you suffer from viral hepatitis, fatty liver disease, be it alcohol-related or not, or have a genetic predisposition. In contrast to other organs, the liver is still very much neglected. What is the point of having all those wonderful therapies if the majority of patients do not even know that they have chronic liver disease or are at risk of developing it? The most basic measure, but nonetheless an important step in the right direction of increasing diagnosis rates, would be to include liver enzyme tests in reimbursed routine health checks. Why does this not happen? As we are in the British capital, let me take the NHS health check as an example, which gives, and I quote from their website, personalized advice on how to improve your health and lower your risk of developing heart disease, stroke, diabetes, kidney disease, and dementia. I do by no means disagree with the diseases mentioned, but I completely fail to understand why liver disease is excluded here. Diagnosis is one issue, access to treatment is the other. In times of austerity, the affordability of therapies becomes more and more of a problem. Bailout countries such as Portugal, Ireland, Greece, and Spain have been told to drastically cut their health budgets at the expense of preventive measures such as needle exchanging programs, as well as price cuts on innovative drugs. The results are disastrous. Infectious hepatitis and HIV have rocketed, and access to innovative drugs is becoming more and more patchy unless you are rich enough to pay for private healthcare. What is the solution? Representing a European patient organization, I can only say the following. The price needs to be reflective of the value of a drug. Is it effective? Is it tolerable? At the same time, it also needs to take into account a country's ability to pay. At the moment, however, it is incredibly hard to understand how countries set their prices. International reference pricing seems to be more and more the fashion, but in our view, there is a little logic behind. It is essential not only for today's patients, but for the long-term sustainability of our health systems and of our economies that we get this right. that we find ways to improve diagnosis and access to treatment. The burden of chronic liver disease is simply too large to ignore. However, I realize that I'm probably preaching the choir. You, as medical specialists, understand this, and we, as patients, understand this. But better liver disease control and greater access to treatment will only come when the decision makers understand this as well. When we join together as patients and medical professionals in a strong partnership, we can reach policymakers and advocate effectively for change. ELPA is proud and happy with the successful partnership we have built at European level, sharing expertise and insights. The medical understanding, combined with the patient experience, opens political doors which either one of us alone would struggle to do. I would therefore like to conclude my short address by encouraging all of you to see your local patient organizations as partners, to work together to address your local and national politicians and advocate for better policies supporting hepatitis prevention, diagnosis, and access to treatment and care. Thank you, and I wish you all a successful conference.